Posterior cervical laminectomy and fusion is a surgery that we do. Usually we do that surgery for arthritis in the neck, bulging disc that are pressing on the spinal cord. And we would do that if we're not able to get it to it from the front. Then we would go to the posterior cervical. So depending on how many levels of problem you have would be how long the incision could be. It could be anywhere from there to longer than I can demonstrate. But they go in and they take the lamina off, which is this part of the bone, open up the spinal canal, and then they end up putting screws into each of the vertebrae with a rod connecting. That surgery is done in the hospital. You spend time in the hospital, probably anywhere from 2 nights to maybe up to a week, just depending. You would work with physical therapy after surgery, might need to go to rehab after the surgery, or you might just need home physical therapy, but the physical therapist would evaluate you along with our staff to decide if you can go home or do you need rehab. It is a painful procedure because all those muscles in the back of your neck have been cut. You'll be on IV pain medicines, oral pain medicines, muscle relaxers. So a posterior cervical fusion is a pretty big surgery to get over. I would say the first 4 weeks, you're definitely not going to do any lifting, overhead work. Probably won't really be able to drive during that time just because those muscles are going to be so sore. You're not going to feel like turning your head to be able to drive effectively. I would say somewhere between 3 to 6 months recovery time, but after 4 weeks, you're going to start being able to do a little bit more and just build up from there. Sometimes you do have to wear a neck brace after surgery. Some of that depends on the extent of the surgery and also your surgeon. We do have one doctor who doesn't use a lot of neck braces, but we have another one who does use a lot of neck braces. So you'll need to follow the advice of your particular surgeon. So leading up to a cervical fusion, I would 100% stop smoking, have your blood pressure under control, get your osteoporosis or osteopenia treated, and just try to be as active as you can going into that.